Welcome to CASCADE Talks, celebrating 10 years of Cascade research.
Croeso i'r sgyrsiau Cascade, dathlu 10 mlynedd o ymchwil Cascade. Dyma podlediad sy'n trafod yr ymchwil a'r arloesi sy'n digwydd ym maes gofal cymdeithasol I blant.
A podcast that discusses and explores the latest research and innovation in the field of children's social care.
Welcome back to the Cascade podcast series. In the series, we're looking at really social work research and what difference it makes and trying to get a sense of the backgrounds and motivations of some of our researchers, but also the research they're doing. And in each podcast, in different ways and with different topics, we're kind of wrestling with the so what question, the what difference does this make? What difference might it make to people? And then also kind of maybe how we understand the role of social work more generally. So I'm delighted to be joined by two of our crack researchers. First of all, Clive Diaz. Hello, Clive.
Hello. Nice to be here.
Brilliant. And Lorna Stabler.
Hi, Donald.
Fantastic. So I'm going to, both Clive and Lorna have recently finished or are doing research about how we implement policies in social work or children's social care specifically. And I find both their studies really fascinating. They've really made me think deeply and differently about some of the challenges we face within the sector. So what I'd like to do is have each of them do two things. One is say a little bit about yourself and particularly what brought you into this type of research, and then a bit about your project. And I thought I'd start with Clive because your project is finished rather than ongoing. So Clive, do you want to say a bit first about how you became a social work researcher, what your background is?
Yeah, so I trained to be a social worker originally at Bristol University a long time ago in 2004. And I worked as a social worker and a manager and a reviewing officer for the emergency duty team for about, 7 or 8 years in sort of direct, I guess, frontline-ish practice. And I felt I wanted to understand more about practice. I was particularly interested in families' experiences of social workers and how we could improve that. For a while, I used to chair child protection conferences and also children in care reviews. And I was always struck by how particularly the child protection conferences seemed to be a very negative experience for parents. And I just wasn't really sure, why we'd got this system of child protection conferences. It didn't seem to really help social workers and families build up a good relationship and work well together. In fact, it seemed to be very adversarial and do the opposite. So I started doing a doctorate and interviewed young people and parents and social workers about their experiences of working together. And I guess that was what fueled my interest. Shall I talk about why I wanted to do this particular study?
Yeah, well, it would be interesting, but actually maybe we could hear a bit from Lorna about what drew you into research, and then we'll come back to the actual project. And it's interesting you mentioned family group conferences because that is indeed the project that Lorna's going to be talking about. But first of all, Lorna, tell us a bit about you.
Yeah, so I have been doing children's social care research for, I guess about 8 years now, which feels like a long time.
Adds up, doesn't it?
Yeah, it does. And I started, actually, funnily enough, before I became a social care researcher, I didn't really know social care research was a thing. I was working as a researcher at an exam board, particularly looking at how we could teach and assess kind of 21st century competencies, they're called. So things like collaboration, creativity, team working, things like that. Generally our education system says that it wants to instill these things in students, but instead assesses kind of things like whether or not you can remember dates and formula. So I saw a job that came up on a project that, Donald, you actually set up, even though you'd left by the time I started.
Yep. I think we met. I remember you walking into a room, but I think it was sort of literally sort of you were arriving and I was leaving type of thing. Yeah.
I think you'd come back on one of your whirlwind tours of all of your projects you'd set up. So you'd come back to talk to the local authority, and I came along. I think you brought Lucy Sheehan with you.
Oh, right.
But yes, so the thing that really interested me about that project was it was looking at how social workers could kind of learn to develop their skills in terms of how they interacted with families, but also how those can be measured and used as a basis for feedback for social workers. So rather than thinking about how many visits they went on, in which timelines, actually, what was the experience of families when they were talked to by this social worker? Was this social worker working with this family in a collaborative way? And what was it, about the language that they used, how they were with the family, that helped that family feel like this was a true kind of collaborative process, for example. So it actually linked very well with the work that I'd been doing at the exam board. But also, this was the first time I'd kind of seen a social work research post, and it kind of really chimed with me because I have my own experience of having had social workers in my life, having spent time in foster care and having been a kinship carer myself. So I think I always felt that the way social workers worked with me and my family wasn't great, didn't necessarily help us achieve what we wanted in our lives. So I was very interested in whether or not social work could be done differently, and if that could change the experiences of children and families, and ultimately, their outcomes.
Mm. And then that's led on to a current project, which we'll talk about in a minute, around family safeguarding. That's fantastic. Thank you, Lorna. So Clive, do you want to tell us a bit? I know you work across lots of different projects, but for the theme for this podcast is really implementation. And I know because I was part of the project that you've just finished a project around it. Do you want to say a bit about the project around implementing child sexual exploitation guidance?
Yeah, so quite a few years ago now, in year 2000, I think, we applied for some funding to do a study around the implementation of new guidance that we knew was likely to be coming out in 2021 around child sexual exploitation. We got the grant and we carried out this study, I think 2020 to 2023, roughly. And basically we did what's called a realist study. So what that very briefly involved, in this case at least, is trying to develop a theory about how this policy was being implemented, or maybe wasn't being implemented, and via mainly interviews and focus groups with practitioners and managers and policymakers, and indeed the people who drafted this policy. And then we tested this theory through a whole number of focus groups. We did some surveys, we did some workshops, and we came up with a final theory around particularly this piece of guidance and child sexual exploitation, how it was implemented or not. And one of the things that realist studies are interested in is looking at the particular context. So you might have one intervention or one law or regulation that works and seems to have a positive impact in one place, but it may not do in another place. It might not have the same impact. So we were very interested in the context, and we looked at 3 local authorities in some detail that were all trying to, with various levels of success, trying to implement this policy in Wales. I mean, the context was difficult because the study was carried out and the policy was being implemented during the COVID pandemic. There was, still lockdowns going on. So it was a difficult context, both for the study and definitely for the people trying to get this policy implemented. So I guess to be honest, the quite bleak first finding was that a lot of social workers and indeed practitioners more generally across the sector did not really know about this new policy. Now, that part of the reason for this could be the study was carried out fairly quickly after the policy came out, but we did actually carry on for a year and a half, 2 years in, and still people weren't really aware of the policy. Many people weren't. The survey was carried out, I think, a year and a half after the policy came out, and still most of the respondents hadn't heard of it. And they were confusing it with different policies. There are quite a number of different policies in this area. I guess some interesting findings, I think, were around this policy was quite based on values and trying to get social workers to work in a child-centered way, to think about how they were working with young people, to work in using trauma-informed and strength-based approaches. It wasn't very procedural policy. And I think that did provide some real difficulties. I think it's what we found was that people tended to already think they were working in a child-centered way and trauma-informed way, and they were very strength-based. So if a policy says something that they're already doing, and they feel they're doing it, whether they're doing it or not, it's difficult to know, but they thought they were doing it, then the chances of that policy having much impact on practice is pretty minimal. And I think that's that's a big problem. I mean, I remember as a social worker, when there'd be a policy come in, around the laming review, and you'd have to fill out an assessment, and it'd have to be signed off, then you'd have to do the plan. You sort of had to do that process, otherwise the computer would sort of start shouting at you, and your manager you'd be on a list. Whereas something like this, work in a child-centered manner, work in strength-based, well, that's very difficult to measure, to think about. So yeah, very difficult to see that this policy, as far as this study was aware, had significant impact on practice, as far as we could tell.
Yeah, so early days, but I think it is that issue. I started to sort of wonder whether a lot of the challenges we have in children's social care are that essentially policies that are easy to implement tend to be bureaucratic and create a more and more bureaucratic system, whereas policies that are about sort of improving practice, changing how we work with people, are really, really difficult to implement, and therefore often just don't get implemented. And so you've got a sort of ongoing tendency within children's social care, perhaps within other systems, to become more and more bureaucratic because other things are really difficult to make happen. But it might be interesting to hear now, Lorna, a bit about your study, which is still ongoing, but has been going. Well, I'm also involved in this project. I have to admit I feel it's been going on quite a long time, but I think it's coming towards the end. Do you want to tell us a bit about it?
Yeah, I mean, it has been going on for quite a long time, but I guess one of the things I would argue is that implementation takes a really long time. And that is one of the reasons why change is hard, because time isn't given to allow changes to bed in and be supported for a long period. So the project, we're coming towards the end. So it ends at the end of September this year, is focused on whether or not a particular family-led decision-making model called family group conferencing can replace a statutory process, so the initial child protection conference, so like Clive mentioned earlier, to be a more family-led way of making decisions around safeguarding for children. So family group conferences are used quite extensively across the UK now. I won't go into the history of family group conferencing, but it is a model that has been around in the UK for quite a long time now, is well used, well established. The Family Voice study from CASCADE actually is doing a really good job of mapping out how family group conferencing is being used in different areas in the UK for different purposes. But essentially, it's a way of bringing together a family with their extended network to share information about what the concerns may be from a kind of social work, but also multi-agency perspective, and then giving families the tools and the time to come up with their own plans to address those concerns. So rather than something like a child protection conference, which, as Clive mentioned, can feel quite adversarial and quite shaming for parents, this model is about actually breaking some of that down and putting families in the best possible position to come up with solutions to the problems that quite often they know more than anyone are facing them and their children.
That's such a common sense thing to do, and so in line with our values, that it must have been really easy to get local authorities to take that on, Lorna.
So you'd think so. And the interesting thing is, actually, quite a lot of local authorities did approach us and did want to make this change. They recognize, like as Clive said, like social workers themselves, social work managers, IROs, child protection chairs, like they all recognize that this process is not one that's particularly conducive with supporting families, with helping families come up with the best possible plan, or even helping practitioners come up with the best possible plan as to what to do next. Logically, who is going to keep children safe? It's the people who are in their lives day in, day out. So what could be better than having, more people engaged, aware of the situation, and kind of actively offering solutions? But I would say, so thinking about the difference between my project and Clive's project, where he's implementing a policy that, the Welsh government have, signed off on, have agreed, have developed in local authorities. This was almost local authorities coming up with their own solution to a problem that was in certain ways pushing back against some of the policy that exists at the moment. So, with the care review in England, there was a focus on a need for family-led decision-making, families to be involved at these kind of key points in statutory intervention. But there was no real clarity around, what model to use, when this needed to be done and how. And I think systems will always fall back on the thing that's counted. It comes back to that very first project that I worked on with you, Donald. Like, it's really, really hard to get people to do things that they're never measured on. When you've got so many other priorities in the system, you've got, like Clive says, there's computer systems flashing at you because your report is overdue. If it's just it's a nice additional thing to have a family group conference, but you have to have the initial child protection conference within a certain time frame, then it's the family group conference that drops off the agenda. I think as well, you were talking about like policies and it's quite difficult to change values. Well, I do think there is a bit of a loop, right, with research, policy and practice. So policies could recommend evidence-based models to implement. There's not a huge amount of evidence that family group conferencing is particularly effective in terms of achieving outcomes for families. But there's, it feels like enough qualitative evidence now that family group conferencing is a better way of working with families to engage them around making decisions than the process at the minute. So
also, there isn't much evidence for child protection case conferences either. I mean, it's a bit random which things get picked up. So we say family group conferences need a lot of evidence because they're a new innovation, but we just do child protection conferences where, and at this point, I think, anyone who wants to chip in can do, but, the evidence for child protection conferences is not great. And I think, and Clive, you've looked at this, the qualitative evidence of people's experiences, children and parents' experiences, is that it's often a horrific experience for people.
Yeah. I mean, I think it's, I don't know of any evidence that says that. I think they maybe help manage anxiety. I don't know, professional anxiety, and think, oh, well, some other people know about it. It's now someone else's problem or fault if it all goes wrong. I don't know.
Well, let's touch on the sort of bigger question of why do you think, Lorna, either with this specific instance or more generally, why do people find change within children's social care so difficult?
Yeah, I do think child protection conferences, but processes more widely, they do serve a function. And I think one of the issues is that when we try to create changes, we almost ignore the function of what's happening at the moment and how that's working. So we don't always map on what we want to do to make sure that it also covers the functions that are there. So professional anxiety is also really high within children's social care. The amount of meetings that I've been in where everything's gone positively until someone says, but what if a child dies, right? This is what social workers are thinking about all of the time. So if that process that they follow at the minute makes them feel like if a child dies, they are not going to be held accountable because they've followed the process, that's a really, really strong imperative to use that process, right? So I think there is something about acknowledging the fact that it's a really difficult area to operate in, but also that social workers are held accountable if anything goes wrong. So within that setting, doing something differently that is handing power over to families, it's bound to be tough. There's someone just saying you should do it, but full stop. You're not going to get much support around that. And the legislation isn't going to change to say you're doing, quote unquote, the right process. It feels like it is almost impossible in that context.
Yeah, absolutely. So you think children's social care is a more difficult context than most because of this kind of the risk and or the sense of risk and blame. I think blame is perhaps the word that's key here, because lots of people operate in risky environments, but there's something about the way society talks about children's social care that it has been very, very heavy on blame. And obviously there's lots of research around this and the impact it has on social workers. So that makes change even more difficult. Is that a kind of core element of what you're feeling? I suppose it is also worth saying change is just difficult. I mean, even not in that context. I mentioned to both of you before, I have a laptop. I can't use SPSS, which is the statistics package, on my home computer. So they've given me a work laptop to set up and a docking station. And about 6 weeks in, I still haven't done it because it's the simplest of changes, but it would require a couple of hours of work. And people are notoriously difficult at changing, diets. They don't stick to diets. They don't stick to exercise regimes. So change is a difficult thing in general, I suppose. Do you feel change in children's social care, and this is for both of you really, is more difficult than change generally?
I mean, there's also so my project's funded by NIHR, so the National Institute for Health and Social Care Research. And the resources available within hospitals, within a healthcare setting to support change, to support implementation of new programs, you don't see anything like that in social care. So, if you are doing research within a hospital, well, you go to your research nurse or the research manager within the hospital setting, who is then the person who will get consent and kind of think about recruiting into the study. In children's social care, these responsibilities to kind of implement, new programs, to collect evidence, it falls as an additional responsibility on people who already have an extremely high workload. So I think the resources are completely different, and lacking in children's social care compared to a healthcare setting.
And compared to the private sector, my brother-in-law, he works with companies to do change management programs, and essentially it's implementation. So it's I don't fully understand everything he does, but so he did something for Mercedes dealerships where they were changing the interface with the main company, and they didn't just say here's a new interface. They literally had to roll out training and support, and the whole project lasted 18 months, and he and two other people were just dedicated to doing that. So there's a sense in which sometimes, at least in the private sector, it's also not just you need to do things differently. There's a support for change that goes in. So we have a sort of situation where change is really difficult. We don't resource it properly. There's an environment where there's a great deal of blame and therefore anxiety about change. Are there any other factors or features that you'd identify?
I mean, I think at the beginning I mentioned the tick box element, and I think that is quite important because I think, when changes are about a form on a computer or risk assessment, they probably do happen in children's social care, and, Ofsted come and check on them. I mean, children's social care love auditing. All the local authorities I work with, they do millions of audits, but generally they're checking, has something been done on timescale? They might comment on the quality of an assessment. They might even occasionally speak to the parents, but they're not going to do an observation of practice or have an in-depth discussion about what difference the work's making. It's very procedural, and 90% of it's about what's on the electronic file, which we know from, I think, your and David Wilkins' study, Donald, that, what people say in supervision and then what's in the notes are two totally different things.
Yeah.
So it's very complex, I think.
Well, it's very complex and challenging, but it does raise the bigger issue. What difference are we likely to make as social work researchers? What difference can social work research make? This is a question I think about a lot. There's that meme going around, how much do you think about the Roman Empire? I've never really understood fully. Well, you're both looking quizzical as well. Anyway, my kids tell me this was the thing going around. I don't spend that much time. I do spend a bit of time thinking about the Roman but not that much, only because I listen to the Rest is History podcast. I do spend a lot of time thinking about what difference does research make? What difference do I make? Are we making a difference in Cascade? are different projects actually making a difference? What's your, this is a line of work you're dedicating at least this bit of your life to. What would be your response to that question, I guess?
Like, I definitely grapple with that. Like, I'm the kind of person who will throw myself into something 150%, you know? So for me, kind of coming into this research, it was kind of with a curiosity around kind of, can this be done in a better way in the UK? And what I see all the time is that, yes, it does have the potential to work differently. You meet individual social workers and they really care about the families they work with. You know, they're coming into this because, you know, they want a kind of more equitable system. They want children and families to be supported, to kind of have the same opportunities, you know, as any, you know, other family might have, and to be supported when things get hard, right? So I see that, and I see that there is a lot of kind of goodwill within that system, and there's a lot of interest in research as well. I think it's not so easy to to translate what you find or what practitioners care about into meaningful kind of policy change, and that's a real barrier. But I guess for me, like, I'm really heartened by the fact that as a researcher, when I'm working closely with local authorities, with practitioners, they come to me and they ask, they say, like, what is the research evidence about this? Or how can I frame what I want to do, you know, in a particular way? So, for example, one of the local authorities that I'm working with at the moment, a couple of kind of quite senior people within that local authority are really keen on framing the use of family group conferencing as an alternative to kind of initial child protection conferences from a rights-based perspective, right? So what they want is some research, you know, what's the research evidence around kind of how social work should be upholding children and families' rights? Kind of, how do you point to that? And I can say, well, Professor Donald Forrester has a book about this, actually.
Well, I'm very glad. Thank you. You give me an opportunity to plug my book. Thank you, Lorna.
No, but people, like, practitioners, want that evidence. They want to know where what they're doing fits in a wider framework. You know, they want to understand kind of how they can be effective, how they can work in a way that fits with their values. So that kind of reassures me. You know, some people think, you know, researchers sit in an ivory tower and they're so disconnected from practice, but social work research isn't like that.
No.
You know, every day I'm speaking with social workers, I'm meeting with families, like, and that makes me passionate and makes me kind of have some belief that there is a possibility for change because people want it.
Yeah, absolutely. That's also my experience. And also, I mean, as a social worker, I think I rather simplistically thought the management were the baddies and we were the goodies. We were donkeys led, lions led by donkeys. And then as I've met managers and inspectors and people in the Department for Education and, you know, academics across the country, they're all in it to try to make things better. They're not. I'm not saying everyone is completely altruistic, but they are. You don't come into this line of work to become rich or famous. You're trying to make a positive difference. So everyone is sort of striving for answers. And like you, Lorna, my experience is we often have to develop plans about how we're going to get findings out. But my experience is people are really enthusiastic. If you've done a study that has got any relevance, really, that they're really interested. But there are some complexities, I guess, about what research can and can't tell us, which I may say a few words on. But I don't know, what are your thoughts, Clive, on whether you make a difference or whether research makes a difference?
Well, I think it's about picking the topic. I mean, I think with parent advocacy, for example, you know, if we do a study and, you know, it's positive, like it was in Camden, was making a really big difference, then at least internally, that was very helpful to the people at Camden, the senior managers, and they invest more money in it. And we're doing it similarly with another local authority in London, where it's not a randomized control trial, it's not exactly a control trial, but we're going to try parental advocacy where 2 teams are rolling it out and 2 teams covering basically the same area, but that work with families on different, or take them on different days. And then in a year or 2, we'll do a comparison. Has it made any difference around seeing parental engagement? May have even had an impact on reducing the rates of children in care. So I guess it's picking the right study. I mean, obviously, you know, changing the world is, I don't have any, you know, I'm not sure I'm doing that at all.
Well, when I say change the world, I don't mean everything. But you're trying to make a positive difference in your bit of the world.
Yeah, exactly. And I think peer advocacy, try talking to social workers about what they feel about parents, because, going back 10, 12 years ago, when I was a social worker, it was very us and them. It still is. For a long time then, there was this approach, just not child-centered practice, but just about the child. And you'd have this thing sometimes where social workers say, I'm only interested in what's happening for the child, and not show any real interest in parents. And I think that, that even the working together new guidance is slightly more family focused in England. So I think there is some move in some positive changes in that direction. And if we can do a couple of reports or papers that people are, read and think, oh, that makes sense, let's try that, then great. But I think if I wasn't, I do feel I need, for my own well-being, self-esteem, feeling of making a bit of a positive difference, it's about doing something on you think that can make a difference, and parental advocacy I think really can. So yeah.
I was just going to say, I think there's also, it is quite difficult as a researcher because there's different types of evidence. So there's the evidence that people say they want, which tends to be numbers. So it tends to be, right, we want to know, is this cost effective? Does this reduce the number of children in care, etc.? But then when you go and work with local authorities, the evidence that they quite often want is much more qualitative, is much more about stories. How did this work here for this particular family? And that tends to be the stuff that people are really engaged with. So one FGC coordinator within the local authority saying, oh, I did a safeguard in FGC for this family and it went really well and this is how it went, right? That can hugely increase referrals. Whereas if we just focus on what people say they want, which is a randomized control trial that says this reduces the number of children in care, people quite often can disengage with that because there's lots of different, ethical questions about RCTs and how they're run. But we're kind of stuck as researchers, in this in-between place where you need to provide, the evidence that people can base kind of big decisions on, like changing the law or commissioning huge services, but also the evidence that actually changes practice and kind of gets people to buy into doing something differently. And that is quite tricky to balance as a researcher and as a research centre.
Yeah, absolutely. So I suppose my take on that is to do a range of studies that try to address all those things. I'm less and less a fan. Well, randomized controlled trials have their place, and we're going to talk about them in another podcast, so I won't go into that. But qualitative research, absolutely. People's experiences, how things actually work, why they work in particular contexts, rather than sometimes. One of the things that really strikes me when you look at patterns of whether things work is if you've got enough studies, what you tend to find is sometimes things work and sometimes they don't. And that, why they sometimes work and why they don't is really only understood through kind of qualitative research. But I suppose this takes me to a key point that I will make across a number of these talks, which is there is no definitive study. There's no ultimate answer. So even if you do several more studies on family safeguarding or policy implementation, we won't have the answer. So in that context, I hope that we're making a contribution to a conversation about what is good practice, how do we make it happen, what makes it challenging. And that conversation has to include those who use services, practitioners, leaders, everyone. Ideally, the whole of society, but particularly those directly involved.
Yeah. And I think the work we do with Rachel's team, Carmen coming over to the conference in Milan last year, there's no way you'd have had peer researchers at the European Social Work Conference 10 years ago. And I think the work that Rachel and the participation team do with the CASCADE Parents Group and CASCADE Voices, that's fantastic, isn't it? And it's empowering for people on lots of different levels. And I think it really does have a positive impact on individuals, but also hopefully a more of a conversation at a wider level.
I certainly hope so. And again, that's another one of the podcasts is going to be looking at our public involvement work, which Sally Holland set up and Rachel Vaughan and others have taken forward so well. So bringing things to sort of towards the end of this chat, I just wondered if there's any take-home messages you'd have about implementation, which can be things you've said already, or things you might want to add?
Well, I guess the one thing I didn't say earlier, which is this issue around national and local policy. So I think particularly around this piece of CSE guidance, which was a national piece of guidance, there were one of the three local authorities had a local piece of guidance that was very similar. Another one had a local piece of guidance that was totally different. And there you end up practitioners being, very confused. So I think the relationship between, whether it's in England or in Wales or anywhere, between the national sort of policymakers, the local leaders, and then the local practitioners, and then the families, good relationships as far as possible across those various different groups of people is very important. Understanding why we're bringing in a policy, why it's important, why we want to make this change is really key, and involving people across those groupings is really important. But I'd like to go back and do this study again in a couple of years. 5-6 years later, it'd be interesting to see, and definitely, in England, working together is bringing in some interesting changes. So maybe we can look at doing some further research on this area, because I think we really do.
We certainly need more research on implementation. There's remarkably little in children's social care, and very, very little in the UK.
Yeah.
Lorna, your thoughts?
Yeah, I think for me, not to be gloomy, but a lot of change needs to happen in children's social care in the UK. This isn't like a tinkering around the edges. Like, most things are fine, but we need to tweak some things. Some of the changes that we're talking about are like thinking about like a fundamental overhaul between the power relations of the state and kind of private families, right? Removing children from their parents is, a huge state power that should be wielded extremely carefully. So for me, I would say that we just need to be realistic with our expectations. So as researchers, as practitioners, as policymakers, around, how long this is going to take and the resources that are going to need to be there if you want to make a realistic long-term change to children's social care. But part of that is working with people to develop that vision of, what the change could look like, and what people are being asked to do differently, is helping them achieve, is working towards that kind of positive future and that positive change. I think sometimes within children's social care, like, it's so, for practitioners and also researchers, right? It's so fast. You're working on lots of different things all at once. You've got, increasingly tight deadlines. You've got more tasks. You've got high staff turnover, quite difficult work conditions. It's really difficult to think about what is this future that we're working towards. And for me, without that, any kind of small pockets of change, are unlikely to be sustainable and unlikely to be kind of the most strategic way of kind of working towards that different future.
You've opened up rather a big alternative topic there, haven't you, of whether we should try to adapt what we have now and make it as good as possible, or start again? Is that?
Well, I did say I wasn't going to say burn it to the ground and start again on this podcast, but no, I don't. It doesn't necessarily have to be one or the other. I think you can make incremental change, but you have to know where you're going. You can't just make little changes and hope that at some point they all converge into, a much better system, because there are lots of things that can inhibit those changes. So I do think you can tweak things and improve things, but you need to be working towards a bigger whole at some point. I'm not, the whole metaphor of like, don't burn the ship before you've built something else to move into and all those things. I'm not, an abolitionist, so to speak, but I do think you need to be a bit more strategic sometimes if you are thinking about incremental change towards kind of a transformed system.
Yeah, we won't have time to go into this, and maybe we should pick it up at a future one. But I suppose my book in some ways was, or is, responding to that abolitionist tendency. And I think I concluded we're going to need something to do the complex balancing exercise of different rights. And sometimes the abolitionist sort of way of talking about things is rather simplistic, as if we wouldn't have to think about how we protect the right of the child to be kept safe versus the family's right to family life. So I suppose I'm more of a reformer, but I think I tend to think we need radical reform rather than mild reform. I think something I think you may have said this, Lorna, but that struck with me from our study is we have an awful lot of reforms within children's social care. People are always new guidance, new policies, new ways of doing things. We're very, very, very rich in that. Well, rich, overburdened might be another word. And if I was going to make one immediate wish just on the implementation side, I'd say 1/5 as many new initiatives, but spend all the time and effort that you've saved on actually implementing them. So rather than, just a new policy and a new, let's have new guidance and roll it out, which are the ones that are really important? And then let's put in the resources we need to actually create those changes. And I feel if we really took implementation seriously, we would begin to see some real improvements in at least the areas that we could focus on. So that would be my kind of wish, but whether that's a likely wish, I don't know. This has been a fantastic chat, really interesting for me, hopefully for those who've been listening. Thank you very much, Clive and Lorna, for joining us. And I think we'll have you back on for a subsequent one if we're fortunate. So thank you very much. And bye-bye to you who are listening.
Bye-bye.
See you soon.
Diolch am wrando ar y benod hon yn ein cyfres o bodlediadau Sgyrsiau Cascade 2024 sy'n dathlu 10 mlynedd ers sefydlu Cascade.
Thank you for listening to this episode in our 2024 Cascade Talks podcast series celebrating 10 years of Cascade.
Mae'r ganolfan ymchwil a datblygu gofal cymdeithasol I blant yn ymdrechu I wella llesiant, diogelwch a hawliau plant a'i teuluoedd.
The Children's Social Care Research and Development Centre strives to improve the well-being, safety and rights of children and their families.
Diolch I ymchwil iechyd a gofal Cymru am ei cefnogaeth ariannol.
We'd like to thank Health and Care Research Wales for their funding support.
Ac I gael rhagor o wybodaeth ynghylch ein dathliad, 10 mlynedd a gwaith Cascade, ewch I cascadewales.org.
To find out more about our 10-year celebration and the work of Cascade, visit cascadewales.org.